How can we put health back into healthcare? That's the topic that we're going to be addressing today on Flourish-Meant. I'm your host, Tina Yeager. Today, I have the privilege of having an esteemed guest with me. His name is Dr. Avery Jackson III, and he is a board-certified neurosurgeon. He's also the founder, CEO, and medical director of the Michigan Neurological Institute. And in his spare time, I don't know where he had that, he became best-selling author of the book, The God Prescription. And he's also founding a brand new concept, a network of certified and independent practices and institutions across the country that are free to provide member-centered wellness, a whole new vision of healthcare called the body healthcare. So we're going to talk about what it looks like if you were to take back the health piece of healthcare instead of it only being focused on sickness, on drugs, on treating the disease with just the surface symptoms being addressed. So welcome to Flourish-Meant, Dr. Jackson. I am thrilled to have you on the show. Can't wait to hear what you have to say.
Thank you very much, Tina. It's a pleasure.
So can you talk about what motivated you to get started in this member-centered, health and wellness-centered approach? As a traditional medical physician, that is not a common way of looking at healthcare, is it?
No, it's not. Well, really, my story began at the age of 8 when my grandmother had a stroke, and I asked the Lord, I prayed to the Lord, and I said, how can I help people with brain problems? And he said about 3 months later, kind of inside, I want you to be a neurosurgeon. Didn't know what that was. Looked it up, and the definition was a spine and brain surgeon, and I said, okay, I'll do it. I didn't look back, and now fast forward 40 plus years, with the advent of COVID, I realized that some of my thinking has been guarded and I wasn't exposed to holistic care. And what I mean by holistic is, the Word of God describes us as a tripart being. We are a spirit, we have a soul, which is our mind, will, and emotion, and we live in a physical body. And seeing what was going on with COVID, I realized there were so many other ways that we can help people in spirit, soul, and body. And on the body side, realize that there are natural remedies that are as powerful, if not more powerful, than the drugs that I used to prescribe with less or zero side effects. And so that really caught my attention. Meeting colleagues who were also having similar challenges led me on this journey.
This is a fantastic topic, and it's very timely. More people are getting interested in this. However, it has become glutted with more of a new age centered focus. How can we make sure that we are choosing a faith centered focus on our wellness?
I think that's a wonderful question, Tina. And I would say that when we say faith, I think we have to understand what do we mean by faith. And there are universal principles, there are boundaries, there are guidelines, and you have to choose which guidelines and who you're listening to, because if you try to mix and match faith, if you will, you'll find out that you're not going to really get anywhere. When we have the Christian faith, there are principles and guidelines that govern our universe, that govern our health and spirit, soul, and body. And those guidelines are consistent and the results are consistent. And there's a faith that's consistent that runs through all of these areas, and especially science and medicine. And for instance, the Word of God says that laughter is good medicine. There were studies at MD Anderson, a major cancer institute, that confirm this. So now, along with traditional allopathic treatment options for those people who have cancer and other diagnoses that are more chronic, they've added laughter yoga. And so we understand now that kind of confirms what we already knew from the Bible. But then you take it further. There's science that talks about the natural killer cells that function in your immune system when there's laughter, and how your risk of having poor wound healing or upper respiratory tract infections will decrease when you're happier versus when there's depression. So now there's an intermingling of faith and your soul, mind, will, and emotion, and your physical health. There's an intermingling. And I think that's something that we really should have begun long ago when we look at science and health and wellness. And we see that the AMA actually tried to marginalize these other thoughts so that most of what we were doing in medicine falls under the biomedical industrial complex. And that's more with the medications and the procedures and specific protocol that got us away from looking at the whole person in spirit and soul as well as body.
How can we focus more on prevention in our healthcare and staying healthy as opposed to simply waiting until something's wrong?
I think that's another excellent point. We're seeing now that there is a crunch financially. And so when we're looking to be wise at our financial life, how do we do that? Well, one of the best ways is to be healthier physically and emotionally. So I tell people that they should really be drinking about half of their body weight in ounces of water a day, roughly 8 hours of sleep and exercise, getting 30 minutes of sun either early in the morning or late at night in terms of infrared light exposure and the benefits. Faith is important, and relationship. Those are all important pieces, and those require some small sacrifice or some effort. But with that effort, you can decrease your medical cost overall. And what you'll find, Tina, is that when you look at people who've had significant financial struggle, what really puts them under is usually some major health issue because their health wasn't maintained. And now there's a large issue that's going to require thousands or hundreds of thousands of dollars to correct, either in surgery or because of an emergency. The top 3 killers here in America are stroke and heart attack and cancer. But when you look at the top 2, the stroke and the heart attack, there's a direct correlation with increased blood pressure, for instance. Well, we know that you can literally reduce your risk of stroke or heart attack to 0. And I'll say that again, to 0 in people who have a sedentary work lifestyle, either standing for 6 to 8 hours or sitting for 6 to 8 hours, by simply exercising 300 minutes per week. And that exercise could even be dancing, as long as you're getting your heart rate up consistently. So that's an effort that is required on our part, but it's a good thing because we're not subjected to all of the other chronic diseases that people face that lead to medical emergencies that can be costly, both in terms of life-saving or not, but then costly financially as well.
So this isn't just about the sacrifice that you're making. It's actually an investment of your time and your effort, because you can put time and effort into all kinds of things, but with regard to your health and well-being, that will come back to you in saving you the ability to work better so you make more money potentially. It also would save you in time because you're able to focus better, and the time that you do spend will make you more productive later. And then the things that you put into your health would also come back with better health and saving you money in regard to treating diseases and chronic illnesses, right?
That's right. I completely agree.
So talk about what the body health care means and how that would change our healthcare system and what you envision for that to do eventually.
Sure. So the body health care it's a private membership organization. So it functions outside of the state and federal regulation. So that's an important first part. As long as it's obviously performing lawful duties, which it is, and it's a 508c1a. So it's a church entity. And the origins of the body health care is based on our Judeo-Christian faith. So on my board, Peter McCullough, for instance, who is a Christian, is our chief scientific officer. And we have many others on the advisory board across the country that are of Judeo-Christian faith. And the reason that that's important is because we need to have an anchor that's going to guide our business activities as well as all of our strategic activities with our members and partners. Its emphasis is on education and protecting the individual clinician and the client member that's being served, member to member. And this gives us some freedom. It gives us freedom to perform more naturopathic, holistic treatment options, and lots of education and lots of guidance, and so that they can educate each other, become certified in functional medicine and other various disciplines that would be helpful for the whole person. Or the 5 and 10-year plan are building small hospitals and then building tertiary care centers that are all membership based, so that we'll be able to protect the clinician client member relationship from big pharma and from the insurance companies and from some of the capitalistic scenarios that have really ravaged our current healthcare system. We know it's broken. We now understand that people have to stay sick in order to fund the initiatives of the current healthcare system. And we understand that any system needs money and needs resources to function. But we've seen that there's been a disproportionate amount of revenue going towards healthcare, the healthcare systems currently, and yet we're not getting out of it what we've invested into it. And so we have to change. And this is the way to change. The way to change is to focus on our faith, and that will dictate our emotional health. And our emotional health will then help us to make wise decisions about our physical health. And then the number of interventions that are needed, especially emergency interventions due to chronic conditions in particular, will also lessen. And so financially, this will be wise too. So the body health care we're in every state in America. And we can protect the naturopathic space in particular. We also have developed a publishing company that will protect scientific journals and studies that aren't influenced by big pharma. And that's important too, as the science guides clinicians in how to take care of the non-clinicians and themselves. So that's another part. And the goal is to start out as a baby pony of a healthcare system that's protected by a citadel of this private entity, church entity, until it grows into a Trojan horse, and then it can benefit many others in many different ways.
So eventually, this could replace the need to have insurance-driven healthcare. Is that what you're saying?
Exactly. What we're seeing now on the provider side is the providers have to grapple with the insurance companies in getting revenue and getting procedures paid, and it's a nightmare. And so it's literally draining the average clinician that's in private practice and the average institution of insurance payments. 70% actually go to the insurance companies, and only 30% of payments go to actual health care. And so that number is wrong. It's top heavy. It should be the opposite way. And so by not having an insurance company or insurance company model per se, we'll be able to level the playing field in the emphasis on where resources should go across the country to be more of a help to people and to really build their spiritual, emotional, and physical health. There is integrity from the top down, and that it's a decentralized system in which we're protecting the individual rights of the business owners, the members, and the clinicians. And we're coming together as a coalition. We've learned so much from COVID, and going forward, being able to put our resources together to help each other as clinicians and as non-clinicians so that we're not blindsided like we were a couple of years ago.
Yes. And so will this replace a member's need to have that government mandate to have insurance eventually, or now? Does it now?
Right. And so it will eventually replace that need completely, because we're starting at the primary care level so that it will replace the services that are provided for basic health care. And as we grow in number and as we grow in our financial resources, then we'll have entire institutions and then ultimately businesses that will also be a part of this. And so the employees of those businesses will be able to take advantage of what we're offering in terms of the independence and protection in healthcare across the board.
Oh, that's fantastic. That's really great news. Such a hope on the horizon for that. Will this include mental health and all the other ancillary pieces to that?
That's right. It'll include every aspect of health.
Well, I can't wait to get into more in the second half of the conversation. But for now, can you share your links on how people can find a copy of the God Prescription, stay in touch with you, maybe learn more about Michigan Neurological Institute or the Body Healthcare?
Sure. So my ministry is the God Prescription, and you can go to www.thegodprescription.com, and you can order my book there. We have several national, international shows on the Victory app and onevoicetv.net, and you can kind of check us out weekly. And for my main practice, the Michigan Neurosurgical Institute, you can go to www.michiganneurosurgicalinstitute.com, and that gives you some idea of our neurosurgical practice. And then regarding the body healthcare at www.thebodyhealthcare or thebodyhealthcare.com, you can become a member and join and take advantage of educational offerings both as a clinician and as a non-clinician. And as a clinician, we're providing continuing medical education for our clinicians for free when they join.
And there's a product that you are involved with and that I have just recently become an affiliate with called Cardio Miracle. How does that actually amplify your mental, physical, and neurological health?
Right. So with Cardio Miracle, what's really fascinating about this is it's a food. It is an organic food that you can take twice a day. It's 2 scoops of powder that you put in water, mix it up, and it really replaces most, if not all, of your supplements. So it helps your entire body become nourished. But what's another piece that's really exciting is there's nitric oxide in this mixture, and nitric oxide is key for repair of the lining of your blood vessels and also blood flow and getting oxygen and needed blood supply to your brain and to other organs. I had someone recently take this for about 2 months, and she's someone that had chronic healing ulcers for years, and that just really wouldn't heal completely. She took Cardio Miracle, and within 2 to 3 months, the ulcers completely healed because she was getting the nutrients that she needed as well as the blood supply and blood flow. So I'm a huge fan, and as a neurosurgeon, I'm really intrigued with Cardio Miracle's effects on the microvasculature of the brain, and I believe that that's going to really reverse some of the issues that we've been seeing with long haulers COVID, as well as some of the chronic brain issues that we're seeing in Alzheimer's and even ADHD in our younger population.
That's exciting news. And if you're interested, if you're watching, listening, and you're interested in learning more about Cardio Miracle or getting some for yourself to try, check the notes here on audio or video. There'll be notes that have an affiliate link where you can get a discount as well. I do hope that all of you will check out each of these in detail because the body healthcare is a very exciting alternative to our current sickness-based healthcare system. And get a copy of the God Prescription, and make sure that you stay in touch and keep following Dr. Avery Jackson III, who has a tremendous wealth of wisdom and expertise to offer. So thank you, Dr. Jackson, so much for being on Flourish-Meant today.
Thank you kindly, Tina. I appreciate it.
I hope that all of you listening were inspired to take back your health and take over your healthcare with wellness instead. And of course, I also hope that you will hit subscribe and come back to the next episode of Flourish-Meant.